My name is Stephen Sammut. I am a senior fellow in healthcare management at the Wharton School of the University of Pennsylvania in Philadelphia in the United States. I am a visiting faculty member at the Strathmore Business School and designed and structured the Healthcare Management MBA program, which is actually very unique to Strathmore and currently is the only healthcare MBA program on the African continent. Provided that the governments do not abandon the responsibility to provide quality and accessible care through public providers, then the existence of the private sector is, should not be seen as a negative. In fact, my argument is that it can be have a positive impact because there are going to be different approaches and styles to providing care, different standards, and one model can actually be used as examples for another. And what I would submit is that the public sector, the officials in counties or national governments, should be vigilant over the private providers, not only to assure that they are providing appropriate care, but also there may be very good examples of how things can be done better in the public sector, perhaps more efficiently. Perhaps there are better approaches to compensating physicians, nurses, and other healthcare workers. So there are ways that both parts of the health system can help one another. This is one of the things in the Kenyan context, I would say, probably has to be done at a national level. And that is determination as to what acceptable standards of care and quality care is. What are the standards of practice? What are the minimum credentials, requirements, base of knowledge that physicians have to practice in different areas and represent themselves as specialists? And what kind of outcomes should be achieved for intervention in any given disorder or disease at the given state that disease presents itself, and what the available facilities or medicines or devices or whatever that's equipped. And that should be the same for both public and private providers. And the standard should be as high as they can be reasonably imposed, which in 2015 may be different than what we'll see in 2020, because this system will have to evolve and grow. In Kenya, it might be valuable to take a closer look at how the United States has coped with its federalist structure. I'm not for a moment suggesting that Kenya should do it the way the United States does it or anyone else does it. There is a Kenyan solution to the Kenyan needs, for sure, but there may be some lessons learned. And the balance between what must remain national in terms of national oversight, in terms of education and certification of physicians and nurses, these probably are best done at a national level. Coordination with groups like the World Health Organization or donor organizations, support from other countries for the healthcare system. This probably should be mediated on a national basis as opposed to having those entities work directly with with county governments.